So you're helping people with migraine headaches.
We are.
You say it could be connected to the TMJ joint.
Absolutely. Yeah, want to think about it. Where's your jaw connected? It's connected to part of your head, 10-pound bowling ball with your brain, all this in there. So if the jaw is not in the right place, and think about it, there are only three things really going on here. You have a joint, you have your teeth, and you have muscles that kind of pull. Joints aren't really smart, so if the muscle's out of place, so where do we get our symptoms? If we change alignments or anything, all of a sudden we can change our neck position. So what happens? Migraines, congestion in your ears, ringing in ears. We see this healed in a lot of our cases. So
people with migraines now have less migraines and some have no more migraines?
Absolutely, yeah. A lot.
Just by adjusting the way their jaw comes together?
Absolutely.
Or their teeth?
Yeah, I mean, think about some of these people you see. They have these little short teeth, or they have teeth that are in the wrong place. And what we do in a non-surgical method is we rebuild the jaw in the right place. We don't just keep them trapped out.
You taught this stuff, right?
Yeah, we teach it all over the country now.
Like at that famous, I guess, Las Vegas Institute.
Exactly.
This was, I mean, like 8 years you teach dentists from all over the world?
We do.
Because this is a complex topic.
It is. It's more in dental medicine.
Okay.
You know, a lot of our equipment actually comes from orthopedic. Well, what's orthopedic mean? It's bone. You know, this is all bone, but the muscles put them in the wrong place. We call it habitual. This is fancy words.
All right.
Habitual versus physiological. So if I show you out of habit, this is where my muscles put me because I sit and do this all day. Physiologic, we know this is correct, but all of a sudden the normal feels abnormal. So if you're grinding your teeth down, that's not normal. I don't just stick a piece of plastic in between them. I'm just basically, or I don't stick a piece of plastic to help with sleep apnea. Let's rebuild them to the right place. Instead of treating symptoms, fix it.
So you can fix those things?
Absolutely.
Hey, you're saying you fix the way their teeth come together and their neck pain goes away, their back pain goes away?
Yeah.
Their migraines might go away?
Absolutely. Now, I do want to say this. Now, often there are 2 or 3 things. If I have to correct my posture, sometimes I may need chiropractic work. I may need other things.
But there are certain people, though, by just fixing their bite, they feel a lot better.
Yeah, we worked on one Friday, and I'll be shocked if she is not healed in 4, 5, 6 weeks, and then we go in and just build the teeth in the right place. So I have an example I use all the time.
All right.
Think of these teeth like 28 car tires. So you rebuild the car tires, but you have to have an alignment. Even I know that much about a car.
Okay.
So what basically happens, it's not enough to just rebuild the teeth. You have to put the alignment where you have the 3 things we just talked about. Joint, muscles, teeth in the right place.
Not a lot of dentists do this, is that correct?
It's very narrow. And even though all of our equipment, and one of my mentors that actually helped invent this equipment 20-something years ago, he always says this, my favorite, you know, if you can't measure it, it's an opinion.
So you measure how their teeth are coming together?
Yeah, muscle activity, we're able to actually find out, kind of like a plane flies, exactly where the jaw should be. Back, forward, up, down. And remember, and I'm thankful for this part, I do have to say this.
Yeah.
Thank God that our upper jaw doesn't move. And everyone always looks at me like, well, you're right. And so we're really only working on one jaw. It just happens to have a little joint back there. You can't really get TMJ. That's an anatomical term. That's kind of like saying I have knee or elbow, which are all little bitty joints. So I can help a lot of people. We can help a lot of people. But it takes time. You have to use equipment. You can't, and my wife came up with this. She said, you can't just make an impression and guess.
Because that's how it's normally done.
Yeah. I can't look at you, I have to say this, I can't look at you and tell what your blood pressure is, what your glucose level is.
So you're testing it.
You've got to test it, or not. And it's time for us to move into this. It's time to take what I call the molar mechanic, the dentist, and move us toward the doctor that we're trained to be. And you have to have a lot of training.